Hello, and welcome to the 2025 Advocacy video series presented by the Nevada Minority Health and Equity Coalition. My name is Alicia Love, and I am a graduate level student intern at the MSW program at UNR. This series is intended to bring light to the impacts of recent changes and challenges in the public health and social services space, as well as getting to the heart of why we do what we do and why we continue to serve those in need. It is intended to inspire hope in the community as we resiliently navigate these changes and challenges. Today we have with us Lee McAllister, the Executive Director of the Nevada chapter of the American Academy of Pediatrics, where she leads efforts to strengthen pediatric care statewide. Lee also works for Intermountain Children's Health and is a member of our public policy work group. In August of this year, Lee was honored with the Mike O'Callahan Humanitarian Award by the Children's Advocacy Alliance for her outstanding contributions to children's health. Lee, thank you so much for joining me today. Can you begin by introducing yourself, telling us your story and how you got into this field?
Sure. My first career was in public relations for both the entertainment industry in New York City and the high-tech industry in Boston. When in 1999, I met and fell in love with a medical student who was on a path to become a pediatrician. And his career passion became my shared passion. And I made a complete change in my career and turned to healthcare administration, which if you work at all within pediatrics, doesn't take long before you're motivated to also become an advocate for the patients that you serve. So Terrence and I have been married for 25 years. We ran a solo pediatric practice together in Massachusetts. We adopted a foster child when he was 5 years old. He's now in his early 20s. So it also became a personal story beyond being married to a pediatrician, raising a special needs kiddo and all his extra needs within the healthcare community for this to become personal. In 2004, my husband took me to my first American Academy of Pediatrics conference. And he was a pediatric resident at the time, presenting a poster. And I have been a fan of the AAP ever since. So I'm very lucky that I have both my day job working in children's health, but also my volunteer hours dedicated to an organization that I believe in for so long and to such a high extent.
I love that this is a love story. That was unexpected. Thank you so
It,
much for sharing that. And I love that I love how rooted in love and positivity your story is. And I can see you smiling as you tell it. And I very much appreciate that. That's exactly the kind of thing that I'm looking for in these advocacy interviews because that is worth sharing. So thank you so much for sharing that. Uh,
Absolutely. It is my husband and my child are definitely my why.
can you tell me more about the work you're doing on a day-to-day basis?
Absolutely. So the American Academy of Pediatrics is a 95-year-old professional association for pediatricians born out of advocacy. And so I'm going to focus on my volunteer role, which is just nights and weekends as opposed to my day job, because that's really where the Nevada Minority Health and Equity Coalition come together. But we are one of 67 chapters of the national AAP. Most of the chapters are statewide. So we have one Nevada chapter for the entire state of Nevada. Some states like California have four chapters because they're so diversity rich among very large populations throughout the state of California. But the 290 pediatricians who belong to the professional association, they come together to share three things. Continuing medical education, because science and medicine are always evolving. So a professional physician or other healthcare providers are never done learning, right? There are always new innovations and new insights to learn from. So they come together around education. They come together around networking about having peer relationships and collaborating and beating burnout together. But then they come together around advocacy. They come together because no one knows what they see in their clinics quite the same way that a pediatrician does. And then through their advocacy work, they can let the public know, the legislation know, different audiences know what they're seeing in the clinic and the ways that society could improve public policy to improve the life of children in our state. Oh, but you asked me how I do it on a day to day. So we're all volunteers at the Nevada chapter of the American Academy of Pediatrics. And so the day to day is really finding the passions of the different leaders within the nonprofit. Dr. Steve Shane is passionate about obesity prevention and healthy active living. Dr. Pam Greenspan is passionate about early childhood interventions and diagnoses. Dr. Randy Lamport is passionate about healthy mental development. So it's the members themselves who decide how I'm going to spend whatever time I have for the organization to focus on different advocacy projects with partnership, right? Because while my organization are the physicians and they bring a very powerful voice to advocacy, they cannot move their stories and their information forward without working with organizations like Nevada Minority Health and Equity Coalition, the Children's Advocacy Coalition, the American Lung Association, the Cancer Association. There are so many wonderful nonprofits that are aligned in this work with pediatricians. And I often tell the doctors I'm their coach, right? I'm not a doctor, but I am their coach for how to use their voice for the greatest advocacy impact.
That is absolutely incredible. And to be a volunteer, I think that that just makes everything that you do a little bit more meaningful.
It is a labor of love, but I will tell you, because I've worked in practice management for a long time, because I now work in population health, it is it's an easy way to spend my free time because otherwise the work can get frustrating and you can reach burnout and you aren't achieving things as quickly as you'd like to. And by working not just with the American Academy of Pediatrics, but with all of those advocacy partners that I spoke of, it really is the self-help and the connection I need with other people in this work.
That is a good point. It's like you get to have that community and those partnerships and those relationships and be surrounded by a bunch of people who are all working together to move the ball forward. So that must be very
Exactly.
fulfilling. I can see
It,
how that would prevent burnout.
yes, it feels less lonely.
Yeah. So, given recent changes to public policy, has there been any impacts to the work that you're doing?
So there have been a lot of impacts to the work that we're doing when we think about public health wins, right? Clean air, clean water, wearing seatbelts, these movements throughout my lifetime, right? I'm in my early 50s that have greatly improved not only the length of people's lives, but the quality of their lives. And to see so many of those public health efforts facing real propaganda and misinformation and disinformation today in our world is heartbreaking. You know, I think about parents advocacy groups that I also work closely with. And these are families that have children who are struggling with rare but and very serious diseases. There's a great number of tools to help them live the longest, healthiest life that they possibly can. But that doesn't happen when there's measles in the community. That doesn't happen when there's rampant COVID and flu in the community. the most vulnerable children who are already dealing with a cancer diagnosis or a serious heart condition, that we as a society have let them down in protecting them to help them live their healthiest lives. And that is, it is heartbreaking. It's also infuriating. And the I have talked to the press about this. I want parents to feel that they can talk to their doctor about vaccinations, that they can ask their questions, and that they deserve to get the time and attention of their doctor to get those concerns answered. Unfortunately, we're in a system right now where both the doctor doesn't have the time needed to spend with the patient to get those questions answered, and the patient themselves live in a world where it's too easy to send out misinformation and disinformation. So that to me has felt unique in this particular time.
Are there any other impacts that you anticipate in the future?
I'm an optimist, and I hope one of the impacts of families now realizing that access to healthcare is getting harder and more expensive, access to SNAP and WIC benefits that Nevada families rely on is getting more difficult. Now that families and voters are seeing firsthand the impact of political decision making, my hope is that a year from now, when we have another election, our governor is up for election, other public office holders are up for election. We want people to vote. I did a quick lookup before this conversation. There are about 2 million registered voters in Nevada. And the last time we had a governor's race, only 175,000 Nevadans showed up and voted. And I, I would never tell you how to vote. Just please, though, show up and vote. Kids can't vote. And so parents, teachers, doctors, anyone who cares about kids, show up and vote for the candidates that you think are going to support the needs of children the best.
I also share that hope that now that this is becoming real, that people are going to show up to vote. Um, so you say that you're an optimist. Can you share with me some of the ways that you are remaining hopeful during these challenging times?
Well, certainly through connection. Um, Last week, the I'm going to get their name wrong, but the Nevada Partnership for Homeless Youth put on their annual summit. And so it's a full day of discussions, lectures, conversations, including a large number of presentations from formerly unhoused youth, talking about the reality that these young people face, the real solutions that have been put in place and help people, and then um, what are the steps that we can work together to move forward. And I keep my optimism by spending time in rooms like that as much as I can, surrounded by people who are solution oriented, who are mission obsessed, who keep their eye on the greater prize instead of getting distracted by sound bites. I also seek out, and through the Nevada Minority Health and Equity Coalition, I find these people, I seek out people who understand shades of gray, who understand that talking about complex human issues and political issues is not something that can be boiled down to a soundbite. It requires real time and dialogue, time for that important dialogue between people.
I think that's a very, very good point. I think that it gets oversimplified way too much and just causes division instead of collaboration. So, do you have any advice for other people who are working in the field who are feeling any type of way about what's going on, whether it's self-care or practices in their workspace or whatever you'd like to bring to the table?
Sure. Well, something that even I have been guilty of and need reminders is to take breaks, to take time off, to limit how many hours a day that you work on certain projects. I um, am a certified business mentor with SCORE at the Small Business Administration. And for any nonprofits out there who don't know, you can get free business mentoring from SCORE at the Small Business Administration. But so one of the things I always used to counsel entrepreneurs on who are starting new businesses is it's human nature to put off to procrastinate, right? To put off projects that you don't want to do until they become so overwhelming that that's when we all reach a burnout point. If you can discipline yourself to do 15 minutes, 30 minutes, 60 minutes a day, and then put it away. And then the next day, another 30 minutes, and then put it away. And then the next day, another 30 minutes. Not only are you making manageable bite-sized pieces and getting towards your goal, but you're also protecting yourself and your brain. And you're also setting yourself up for allowing yourself to really think on these very complex problems, right? I often will read something or think about something before I go to sleep that's particularly vexing. And I'll wake up with a aha, like my brain kept working on it while I was sleeping. So I think that's my best advice to both myself and to others is to break things down into bite-sized pieces, go slow and steady. You'll arrive to better options than if you just try to go faster all at once.
Sleeping on it is actually based in neuroscience. It's about your how your memory is stored. So your brain does like a I call it the brainwash while you sleep, and it stores all of your memories and sorts through all your information. So, whenever I have a big decision to make, I always, or my family, I'm always like, let's just sleep on it first.
I have gotten into a new habit with myself too, where especially after lunch, if I write anything and I need to send it to someone, whether it's a document or an email, if it can wait till the next day, I wait till I look at it the next day with fresh eyes.
That's
And
really good advice.
it saves time and it also helps sharpen my message to the person I'm trying to reach. So I think a workshop on brainwash is something I would sign up for. So that that might be a great idea for the coalition.
Well, that's all the questions that I actually have for you today. I wanted to thank you so much again for taking the time to meet with me. And for those tuning in, thank you so much for hearing Lee's story. Please like, subscribe, and share, and check out the other videos in this series.